Hello everybody and welcome to Jeff the Pharmacist. It is awesome to have you guys here. I want to thank you guys for tuning in. It is really great to have you. If you haven't subscribed, please subscribe. That would be awesome. I love to get subscribers. It really makes my day. It makes me smile. Obviously I want to reach 1,000 subscribers one day, so thank you guys for subscribing. So today I want to talk about Antidepressant Discontinuation Syndrome. Sometimes people call it different things like SSRI Withdrawal. Withdrawal is kind of a heavy word now with people taking narcotics and withdrawing or withdrawing from harder drugs. So they call it discontinuation syndrome. Though it really is your body withdrawing from an antidepressant in a way, you have this chemical that your brain has become used to and suddenly it's being taken away, and there's kind of a bunch of symptoms that can occur with that. And really there's even an acronym for antidepressant discontinuation syndrome, and the symptoms that go along with that, and that's called FINISH. So FINISH is flu-like symptoms for F, insomnia, imbalance, sensory disturbances, and hyperarousal. So flu-like symptoms is pretty self-explanatory. What they're talking about with that is fatigue, malaise, which is like a general feeling crappy, general discomfort, muscle ache, headache, and diarrhea. Really the general feeling of coming down with like the flu. So they call that flu-like symptoms, and that's with an abrupt discontinuation of a antidepressant. Insomnia is pretty self-explanatory. Just the difficulty in falling asleep. That's kind of something that runs in my family, and a lot of us have that. Imbalance, that's gait instability, lightheadedness, and vertigo, so feeling dizzy basically. And gait instability is just what it sounds like. Your walk might be kind of funny. Sensory disturbances are kind of like, these are sort of the bizarre side effects that occur with stopping an antidepressant. And the first one's paresthesias, which is numbness and tingling. So we know what that kind of feels like. But the other one is something people call brain zaps. And it's very odd. It's a very odd thing. When I first heard about that in pharmacy school, I was like, brain zaps? And really people describe it as an electric shock going from one part of their brain to the other part of their brain, almost like somebody has attached a wire to their head. And if you didn't know that that was a side effect of stopping SSRIs or other antidepressants, you might feel like you're going crazy, but really it is a symptom of antidepressant discontinuation syndrome. And the next one is hyperarousal, which means anxiety, agitation. I kind of get that feeling if I've had a night of like heavy drinking or something, which I don't really do as much anymore, but back in college, the next day I would feel wound up, anxious, and agitated. So the severity of antidepressant discontinuation syndrome, or SSRI withdrawal, is often is correlated with the half-life of the drug. So a drug's half-life, all that is it's the amount of time it takes for the blood level of the drug in your body to be cut in half after you stop taking the medication. So half-lives vary across all kinds of drugs. All kinds of drugs have half-lives. They all actually have half-lives, and it varies greatly. So the antidepressant with the highest half-life is fluoxetine. So that half-life is 4 to 6 days, and you can imagine that's kind of crazy to have a drug that sits in your body and it takes 4 to 6 days just to go down to half the level. So that's how long it takes for your body to get half of it. And then when I was in school, they taught us that really, if a patient comes up to you and asks you, okay, how long does it take for this to be cleared out of my system, which is something that patients will often ask, how long does something take to be cleared, I guess, completely out of their system. So instead of going into a long monologue on half-life where you're talking about, well, it's completely cleared. I mean, really, a drug is halved and halved and halved and halved until there's like 2 molecules left, and there's one, and then that one is taken out, but they don't know how long that really takes. So you could say a drug is in your system for, you know, a year, but really the rule is 5 half-lives. So if fluoxetine takes, you know, 5 days to be cut in half in the body, so you'd say it takes about 25 days for it kind of not to be around your system anymore, even though maybe there's 1 or 2 molecules floating around and maybe it's stuck in your body forever, or eventually it just gets taken out, who knows. But fluoxetine is really the only antidepressant that is stopped abruptly. Now, you know, doctors might want to taper that, but that is one that doctors will stop abruptly because it has such a long half-life. It kind of has its own built-in taper. Other drugs have much shorter half-lives, and they have more problems with antidepressant discontinuation syndrome, like Zoloft or Lexapro. Those can have more of a, the blood level will go down abruptly, and people will start to really notice the absence of that medication, and they get these finish symptoms. Now, often people feel like the SSRI, or the Antidepressant Discontinuation Syndrome, is their illness coming back. So how do you know if it's your illness coming back, or if it's just the withdrawal from the drug? And really, some of these really odd side effects probably help to tell you whether it's your illness or not. So obviously the Brain Zaps is not characteristic of really anything else than withdrawal from antidepressants. Also, something like gait instability or vertigo is not really characteristic of psychiatric illness. So I think those are actually helpful for people, just to kind of distinguish. And also, depression coming back and things like that usually takes longer than a couple of days. It's usually more of a gradual process. And unfortunately, when the medications are tapered, usually it takes 1 or 2 months to completely taper them off. So that's kind of a drag. And people usually don't have the withdrawal symptoms after a couple of weeks, but some people do, and some people have them for months. And for those people that have kind of persistent withdrawal symptoms from the antidepressants, often they'll be put on fluoxetine or Prozac, and then the other medication will be stopped, and then eventually the Prozac will be stopped. And that way, they kind of use the fluoxetine's long half-life as a way to kind of treat the antidepressant discontinuation syndrome. So it's kind of a handy way to deal with it. You know, obviously people would probably prefer not to be put on anything else if they're trying to stop the antidepressant that they're on, but that is an option. Obviously, for most people, they probably don't consider it their first choice, but it is there. So I hope you all found this useful. I do get a lot of questions in the pharmacy about stopping antidepressants, about tapering, about tapers in general. Any kind of a drug that has withdrawal symptoms, tapers are often employed. Tapers don't usually negate completely withdrawal symptoms, but they're kind of the best way to fight issues with withdrawal. So I hope you all found this interesting. If you're still here, please subscribe. That would be awesome to have you as a subscriber. I want to thank you guys for watching. Thanks a lot.